we usually get very favorable results, even with up to grade 2 tears of the meniscus or the labrum. With our Shockwave technology, what it does is it basically tricks the body into thinking that there is trauma. So it basically creates new blood supply, and after a couple of weeks, it activates the dormant stem cells, and it can actually regenerate and repair torn tissue.
Hello and welcome to the Natural Health Network. Today we are with Integrative Chiropractic and Wellness with Dr. Lauren and Dr. Tran in Fulshear, Texas. They are a full-service chiropractic office. Dr. Lauren, I know that you are new to the practice, and Dr. Tran, you started the practice, you and your wife.
Yes.
Also, Dr. Tran, tell me a little bit, both of you, about your background, education, why you have decided to go into chiropractic.
Dr. Lauren, why don't you start?
I was a gymnast growing up, so I had a lot of back and hip problems just from gymnastics. And my primary care was tired of seeing me for it, so she was like, here, go see a chiropractor. And that was just the start of the journey. Dr. Tipperman was my first chiro, and she actually inspired me to do chiropractic myself. So went till college, went to her. And when I had my internship during school, I went to Missouri, and they were a neurology-based practice, but they saw a lot of kids. And so I didn't know who really I wanted to see throughout school, but that kind of really turned me to kids most of the time.
Dr. Tran?
Actually, my grandma, it started way back when I was a little boy. She said that I had healing hands. Great with massaging people and magical hands. When it came to planting her plants, it would thrive. So she really pushed me more towards medicine. Instead, I chose the money-making route and decided to be a systems analyst. And after a while, I got sick and tired of corporate America, and that's when I decided to change careers. After a really serious accident, it gave me a chance to reset and have a clean start. I started my chiropractic journey when I entered my early 30s, and here I am now. I really was drawn to the alternative holistic medical approach. I didn't want to be full-time doing massage therapy because I know a lot of massage therapists and their hands and joints just got really bad. So I wanted to do something else. That's why I got into chiropractic. And pretty much it's been great for me. I've seen really great stories, which I'll get into a little bit later, but it's a really good career change for me.
What services do you offer? Obviously chiropractic, but if someone were to come to you with either a traumatic injury or a newborn baby, what can they expect when they come in?
For a new patient visit, typically we do a really in-depth history, trying to find out what the pain originator came from, whether it was a traumatic injury or something that they've developed over the years, something more chronic. And we do range of motion assessments, just trying to find out where your limitations are. And then after that, we have a lot of different modalities that we can get into, whether it's the chiropractic treatments, the dry needling, the acupuncture, stem wave, which is a new technology that we just brought into the practice, which has been great for alleviating chronic knee arthritis, healing soft tissue injuries at a grade 2 and less. And then obviously with massage therapy and red light that we combine with the acupuncture, that's been great for people that don't want the manual adjustments. And there are some people out there that don't want to get adjusted, but they want a alternative healing modality, and acupuncture fits that need.
I know there are a couple of people that have come in that just get the activator adjustment and it's effective as well.
So the adjustment itself, it doesn't need a high velocity. We don't need to technically cause the joint to move. It's just basically stimulating the nociceptors in the joint capsule, which creates a loop back response where the brain notices the stimulation and it sends a kind of endorphin response to relax everything. So that's the backbone of the actual chiropractic adjustment itself. And Dr. Lauren can get into more of what she was hired on to, was to help treat some of these pediatric patients and maternity patients.
With my first baby, I didn't realize that I could take her to the chiropractor. I went, but I didn't think to to take her.
Right.
And the most profound thing that someone said to me, she said, think about it, they've been sitting on their head for however their whole existence so far. So if you sat on your head for that long, don't you think you would need an adjustment? And I said, oh, yes. And I think I shared with you some of his first words were right after an adjustment to our chiropractor, and he said, thank you. And he still does.
Yeah.
So,
Yes. Pediatric work is different than adult work. You're using a lot more soft touch. There's no popping, there's no cracking. It's mainly body work. We're stretching them out. A lot of the time it helps with torticollis if they set in the uterus. However long in one position, they tend to favor that side. Sometimes it comes from lip ties or tongue ties, and all that tension just goes to one side. Sometimes it helps them go to the bathroom or feed better or just digest, sleep better. We've noticed a lot of that. And then with moms doing the Webster technique, that's specifically for them, helps just with the bones, muscles, ligaments, just helping everything get relaxed. There's already relax in there, but it's setting it straight. So baby's able to come to better. They're in the right position. They're more comfortable throughout pregnancy. That's the main goal.
when you say moms, you mean pregnant mamas?
Pregnant mamas,
The
yes.
Webster technique is for pregnant mamas, and I can attest to that one as well. It helps a ton. So, what would you say differentiates your office from others? In my experience, I can tell you they're a lot more personable. They know who I am when I walk in. They know my history. But in your words, what would you say?
I think we are very personal. We know everybody that walks through the door. We try and make that a priority to know everybody and be that kind of place that is a safe space. I think it's great that we can see pediatrics up until the older people, bigger people. Dr. Tran's very strong. I think the age range that we have here is great, and all the modalities that we have definitely helps heal a lot.
I think the big differentiator between our practice and some of the other practices that I know is that we offer a lot of modalities. We're not just come lay down and we'll adjust you and get you out of here. If a modality isn't working, we have other modalities that we could introduce. If we don't get positive results within the first 3 weeks of the first month of care, then obviously it's out of our scope and we'll refer you to the appropriate channels to get the help that you need. But in most musculoskeletal cases, excluding cancer, we don't cure cancer. Got to throw that out there. We usually get very favorable results, even with up to grade 2 tears of the meniscus or the labrum. With our Shockwave technology, what it does is it basically tricks the body into thinking that there is trauma. So it basically creates new blood supply. And after a couple of weeks, it activates the dormant stem cells and it can actually regenerate and repair torn tissue. It's a huge breakthrough technology, and we've gotten really fantastic results after we introduced that technology into the practice.
I can attest. I've just come in with really tight muscles, and even just with stem wave treatments, it's an immediate release, and it helps a ton. You also have a pretty large stock of supplements as well.
Oh,
I assume that you give some guidance on that.
that Dr. Lauren and our office manager, Ashley, she's a wealth of information. But Dr. Kim is huge into functional medicine and anything natural that will help your body heal and help your body function at an optimal level. Because once we get older, it's not about pain. It's about functioning properly, not having to wake up with your daily aches and soreness and not having brain fog. Stuff like that can all be addressed through a lot of these supplements she recommends.
So this is the fun part. The stories of patients that walked in one way and walked out another. I love to hear these.
For me, a patient really stands out. She had a really severe case of frozen shoulder. She can literally lift up her arm like this. And she had gone through numerous physical therapy sessions through different physical therapists too. It wasn't just one. She had this condition for 3-4 years. And she gave up. So she went about 1.5 years and just dealt with it. Can you imagine your right arm not being able to lift it up? So she heard about the stem wave. She decided to give it a try. We always do a mapping session, which is just to make sure that the technology is going to work for you. So we offer a quick mapping session of about 300-400 waves. And usually after that amount, you'll feel a little bit of difference. So after that mapping session, she was able to basically move it an additional 10 degrees, which was great because she hadn't been able to get it past 10 degrees, right? So she signed up for the package, and it basically gave her more and more relief. And she was able to restore her range of motion. And after about, about 8 weeks later, about 2 months later, she didn't get back to 100%, but she got back to about 90% range of motion, which for her was life changing. And the pain wasn't there. A lot of times she couldn't sleep at night. So we're basically just restoring her activities of daily living. And for a lot of people, that's all they really want. Being able to play with their kids, being able to bend down, walk up and down the stairs without pain. That's a big one that I found out. But it's just little things like that. We're restoring your lifestyle back.
That it's not normal to live in pain.
Correct.
Yeah.
One of my most recent success stories would be I had a little baby come in for his initial visit, and mom was nervous because he hadn't pooped in about 5 days. And usually that's not normal for babies. Babies poop all the time. And so just very concerned about that. He was still eating, he was sleeping, but he was really fussy and just uncomfortable. So I ended up doing all the body work and kept an eye on the diaphragm and just his stomach, just trying to see if it was hard, just if he wasn't digesting. And we finished up with the appointment, and he came in at the end of the week, and she was like, he pooped. He finally pooped after 5 days. He's finally pooped, and it's been consistent since then. So haven't had that come back.
If we're going to share that, my son again, he has so many chiropractors stories. But when he was a baby, I took him in just for a regular adjustment. Didn't even realize anything was going on, but he was so fussy baby anyway. And I brought him home, and I was changing his diaper, and I'm no lie, I didn't even get it done. Yeah. And he filled it. And we went through 7 diapers. I was screaming at my husband, bring another one. Sorry, TMI for those of you that aren't parents, but for those of you that are, like, so it definitely
absolutely
helps. Yeah. I'm also curious for the acupuncture. I think a lot of people are afraid of acupuncture because there's so much surrounding it that isn't understood. So if you don't mind sharing some success stories around acupuncture.
I do acupuncture as an adjunct to the chiropractic. But with the acupuncture, we always graph the patient to find out where their energy deficiencies are. And the body is just like one big electrical circuit. So you have electrical resistance running through all your bodies. And so we measure the 12 meridians, and we're just trying to find out, the computer will spit out like a graph, basically saying where you're high or low in energy. And then I use that information to come up with a care plan where I put the points to those corresponding meridians, which will either raise or lower the energy to make it more balanced. And then I ask for your symptoms, whether or not you have headaches, whether or not you have sciatic symptoms, indigestion, even like hair loss. I have a patient that came in with really bad hair loss. Her hair was thinning, and I was like, I don't know if this is going to work, but I read up about it. I really believe in you. I believe in this. So can you please try?
Wow.
We went through about 8 sessions, and it looked thicker. It felt thicker, but to the patient, she was like, I love this. So who's to argue? You're your own worst critic, right? Yeah, so she felt her hair was getting thicker, her hair was getting fuller. And I looked at it, I saw a little bit of a difference, but as long as she really enjoys it and she likes it and she really believes in it, that's all we can really ask for, right? Yeah. But going on with the actual acugraph, let's just say like you have symptoms of headaches, which acupuncture is great for. Okay. Headaches, menstrual cramps. I have protocols for even if you are late on delivering your baby. It's a induction protocol, and I've had almost a 50% success rate after an induction session that the baby will be birthed about 48 hours after that. Wow. So any moms out there that are like 3, 4, 5 days overdue and you want adjunct therapy, please give us a call. We'll be happy to help.
Okay.
And we do not flip babies. A lot of times people come in here and say, hey, my baby's breech. We do not flip babies. We help the pelvis get into position where the baby could flip naturally on their own. So that's a big misconception. And I don't want our clinic to or patients saying that, hey, this clinic claims that they flip babies. We don't flip babies. I just need to throw out there. Well,
Just
since we're
give
on
them
this
the space
correct.
Yeah, that
to
makes
move
sense.
themselves. Yeah.
One, the baby knows what's more comfortable. If
Correct.
they don't have the room, then and they're given the room, then
Yeah.
they move into the
Exactly.
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 Yeah.
Okay. And what does that look like to find the different meridians and where the energy is low?
So there are source points, and the source point is the most active point of the meridian. So the meridians are your liver, small intestine, stomach, bladder, kidney. All your major organs have a meridian tied to it. So we put the sensor over these meridians, and it basically tells us what the electrical resistance is. And I use that graph and be like, okay, your stomach is low, your large intestine is high. These are the points to actually raise the energy or sedate the energy to get you more balanced.
Okay.
And then we do systematic acupuncture where we put points in for particular conditions for common symptoms like headache. A lot of people now know headaches, you want to basically place pressure in the web of your finger. That's like large intestine 4, great for headaches.
Okay.
Or for anxiety, you have a lot of anxiety, the point right between your eyes, press it for about 30 seconds, helps relieve the anxiety. So it's little points like that, more towards the systematic approach to acupuncture.
Yeah, and I had always questioned the energy thing. And another thing that was really helpful that someone told me was, have you ever walked by someone, say at the grocery store, that you don't know, and you just went, oh, they're lovely, or
Yeah.
what a sweet person, or ooh, what's going on with that person? Like, you're reading their energy. Obviously, it's different
Right.
healing modalities and things, but just to let you know, it's not something that is made up or movable.
Yes. Yeah.
Okay. Anything else in particular that you'd like to highlight about the practice?
I think we touched on functional medicine. Dr. Kim, my wife, also does. She's big into pediatric eczema. Her protocol is pretty life-changing for parents, especially parents where they've gone through the traditional route of topicals, steroids. Nothing is working. And a lot of times it's due to the moms having GI issues and they're breastfeeding. So it's basically being expressed through the baby's skin. Right. So if any moms out there that have any issues with really bad eczema from their babies, please give us a call. Dr. Kim is great. She'll give you a consultation over the phone, find out if you're a right fit. And most of the time she can help out with any eczema conditions.
Yes, there are other location, other practices. Revive Chiropractic, it is also on the Natural Health Network. So if you are finding us on YouTube or elsewhere, go to naturalhealthnetwork.org, and their practice is listed as well on the vetted directory. Thank you so much.
It was our pleasure.
Thank
Thank you for
you.
having us.
And if you need to reach them, it is Integrative Chiropractic and Wellness in Fulshear, Texas. And as I mentioned, naturalhealthnetwork.org is where you can find all of their information on the directory and contact them. That's where you find this interview as well. So if you have any questions, feel free to email us, message us, find us on social media and YouTube. Thanks so much for joining us.